Hello, everybody, and welcome to the September Public Invention Inventors Gathering, which we have every third Thursday of every month. This is a long form conversation where we invite people like yourself to come in and have a conversation. Today, we have something really exciting. My good friend Victoria Jacqua, who is also a board member of Public Invention and a co-lead of Global Distributed Tracking, is going to be talking, presenting some things, and also, most importantly, answering your questions. I am extremely proud of Global Distributed Tracking because although it is a software only, it's a pure software project, which is different than most of the projects which Public Invention works on, which are hardware specific. I think it's the one that has the largest possibility of really impacting the world in the short term. So I'll let Victoria introduce other aspects of herself now. So please take it away, Victoria.
Thank you, Rob. Hi, everyone. My name is Victoria Jacqua, and in addition to being a very grateful board member of Public Invention, I am part of the steering committee for the Global Open Source Quality Assurance System, which includes our product, Global Distributed Tracking, and I'm the medical community lead for open source medical supplies. This conversation will cover some technical aspects of global distributed tracking, and never fear that you have to remember every aspect of this, because in the email that you'll get after this meeting, there will be the recording as well as a public version of the slides that I will share. So before we get to the slides, I'm going to briefly talk about the seed origins of the global open source quality assurance system and global distributed tracking. So I will share my screen and we will start there. So in March of 2020, Open Source Medical Supplies was founded to support and facilitate the massive COVID-19 PPE manufacturing movement, which encompassed anywhere from maker spaces, individual makers, and small to medium and large manufacturers. And the flag that we raised to the world on March 12th was, there are no open source PPE designs. World, please make these designs so that we can manufacture PPE. At the end of 2020, we published a white paper that documented the data we captured during this movement. And around 48.3 million units of medical supplies were documented, with a replacement value of around $271 million. As I've gone through the last few years, I'm very comfortable saying that that number is an undercount, because I'm constantly meeting organizations that we didn't know about who were making at that time. Because of our involvement in this community, OSMS formed a really deep understanding of distributed data and how distributed groups work. And we'll get into some definitions of what distributed means in a minute. And while OSMS was helping herd the global manufacturing community around this open source ideal, Public Invention was also doing very important work. They took on a responsibility to understand respiratory equipment and oxygen generating equipment, especially oxygen concentrators. And the work of Public Invention in curating and cataloging ventilators and respiratory equipment and determining what open source designs existed in that niche and what they needed to advance their technology was a really big touch point for OSMS, because that's really complicated technology. And Public Invention was taking on a huge brain task that the time required. So again, Public Invention had a deep understanding of, let's say, the innards of medical equipment and what makes them so different, what makes them work together. So fast forward to the spring of 2022, and the Russian aggression against Ukraine had started, and OSMS began supporting GLIA with the open source tourniquet deployment in Ukraine. I could go into that experience in depth, but later that spring, I realized that there were so many challenging things that happened with trying to deploy an open source design in Ukraine or in the EU at large. And a lot of it had to do with there was just no oversight on an open source distributed manufacturing scale. There were documents that some people had. If you were attached to a university, there was quality assurance. If you were attached to a peer-reviewed paper, there was research that was available. But when it came to the manufacturing, open source design and open source manufacturing is such a brand new market, brand new experience that there's not a really big ecosystem built around it. And I wrote a very long email to Rob saying, we need to create an organization that functions in a regulatory body sense, that has checks and balances for open source designs, supports manufacturers who want to manufacture from open source designs, and guides the distribution and the communication of open source product hitting the market. So people know where it's coming from, whether it's safe, has it been tested, and also to facilitate a support ecosystem for people who want to manufacture open source product. That email turned into a meeting later in 2022 with the community that resulted in the founding of the Global Open Source Quality Assurance System as an organization, which is a product or a project of Public Invention. Public Invention fiscally sponsors GOSQUIS. At first, we thought GOSQUIS was going to be the product because Rob, in his amazing skill as a computer programmer, had already started to architect a tracking system that would be useful to meet some quality assurance standards. And as we worked on this software, we realized that we were making two things. We were founding an organization, but we were creating the first tool under the umbrella of that organization. And that software product eventually became Global Distributed Tracking. So I will go over to my slides. So Global Distributed Tracking exists to provide trust and transparency where you need it most. As we researched not only the open source manufacturing market over the last several years, we realized that the need for quality assurance did not exist just in open source manufacturing or open source design. There were several communities that needed a product that was simple, easy to use, and created a standard that could be adopted over many diverse use cases. And our friend Leith Greenslade, who leads the Every Breath Counts Coalition, who's very connected to the International Aid and Humanitarian Crisis Response Network, really taught us that despite the enormous amount of humanitarian aid organizations who all have proprietary platforms, documentation systems of their own, companies that they contract with to run logistics systems, there is an enormous lack of quality assurance tracking on the ground for humanitarian aid shipments. So we were inspired to see that global distributed tracking could not only help open source manufacturing, but could also assist verification and quality assurance for humanitarian aid. And one of the examples that was given that some of us are very familiar with is the unfortunate tendency to do what's called dumping, which is send end of life medical equipment or literally broken equipment to the global south, specifically Africa. And this is where these machines go to die. They are at the end of their software license. Their hardware is no longer being serviced. And there is no communication mechanism for the recipients of this equipment to work directly with a vendor or with a manufacturer and understand, could these machines be fixed? Could we update the software? Equipment is literally dumped on the global south and it causes a huge, huge problem. And this is something that we wanted to address. So although it was originally designed to support the validation, quality, and acceptance of open source medical devices, GDT has quickly grown to support quality assurance in other communities, such as the humanitarian aid and disaster response community, scientific research, and distributed manufacturing. It is the first product of the Global Open Source Quality Assurance System, and that organization, once again, was founded to promote, support, and create open source quality assurance tools. These tools may not be made by Gosquas, by our team, but we welcome the community who have their own open source quality assurance tools to join us and to market or support or grow their tool under the umbrella of Gosquas, because we believe quality assurance is the way to providing trust through transparency. So I'm going to unshare for a minute, and I'm going to go to the first of our videos, and it is a launch video.
Every day, humanitarians crisscross the globe delivering life-saving aid. But tracking those vital shipments to the last mile can often prove impossible. Fraud and theft can be widespread with no transparent documentation to light the way. From the open source team that built a new PPE supply chain in 2020 and became NASA contractors in 2022 comes a solution. Our Global Distributed Tracking System, GDT, allows you to track aid deliveries from point of origin to the final recipient. No download, no login, no fee. With a simple scan of a QR code, you can ensure that aid reaches the right person. Because GDT is fully encrypted, documentation is secure and private, even in conflict zones. Now, anyone with a smartphone can verify chain of custody within their humanitarian mission. Global Distributed Tracking. Trust through transparency.
All right, let's go. Okay, so now I'm going to go to talk about distributed manufacturing or just distributed networks in general, because you're going to hear me use the word distributed a lot. And unless you're in the open source and niche manufacturing community, you may not know what that is. And I use the word distributed not just to describe manufacturing, but just data and information in general. So imagine you're making something or you're working on a project and everything happens under one roof. The sewing, the gluing, the packaging, all of it happens under one roof. It's a factory. But distributed projects, distributed manufacturing, are people that are not under one roof. They all do different parts of the project, different parts of the response, and they may talk to each other or not. They may send part of their product to another place, and that team works on that and then sends it to a distributor. The advantage of a distributed network, which is often the very first formation of a human system, especially in times of crisis, is that a distributed network can do a massive amount of work very, very quickly, and it's self-organizing, it's natural. But a lot of these self-organized nodes really struggle with communication, whether it's communicating all at the same time, sharing the same information, being transparent with what information they have or they don't have. And this lack of communication and information sharing can cause a really rapid burnout of some well-meaning teams. So there are plenty of software products out there who are where there are great places to write things down. We have Slack and Jira and Discord and Atlassian and Facebook Messenger. We have text messaging. We have Google Sheets, Excel. So many places to write things down. That's not wrong, but those systems often don't really match the really simple method that distributed data is shared. Like what's like one way people can just see the information and do so in a secure manner? It's really easy to make a platform that is fancy and works well, but no one like really uses it, or they use it too much and put too much information in there, and then the whole team has to sift through messages and figure out, is this something I have to pay attention to? So having years of experience working with distributed teams in really diverse use cases, both domestic, international, open source design, open source manufacturing, humanitarian aid, crisis response. The GDT team really prioritized making an open source product that avoided pitfalls that we often see in the open source development sector. We wanted to create something that was very simple to use because we believe that open source products should be simple and easy to understand. We wanted a smooth user interface and user experience. Very often, GitHub or GitLab is a graveyard of open source projects that were great ideas, but often they didn't get adoption because the UI and the UX was just not attractive to people. And so it sits in HTML and no one really cares about it. And it waits for someone to take it to the next step. And we knew through our experience with the Global South that we needed to prioritize basic cell phone access. You did not need to have a fancy computer or a cell phone in order to use the product. And this includes avoiding app downloads, because if you have a very low resource phone, you don't want to crowd its storage with many apps. And we wanted to exceed existing standards in quality assurance documentation and only have necessary features. Don't make it fancy. Don't make it flashy. Make it simple. And we wanted to make sure that our product was going to stay active. It wasn't going to have a big flash for a year and then be a dead project that no one would ever use. We wanted to create a team that would keep this product active, keep it in the community, and keep iterating upon it because it's open source. So global distributed tracking enables fully encrypted closed loop tracking. We are moving towards being a zero knowledge encryption and data storage solution. We specialize in providing verification for quality assurance and logistics. We help you record critical information through data capture and data sharing. And we help you document actions such as the movement of information, the movement of objects, or simple documentation in a safe and secure way. These are just a few of the benefits of GDT. We believe that it's going to help fraud prevention, has simple data encryption, so it's easy to understand, and it's portable because we have an open source license. And it provides supply chain accountability, which is very diverse. It just doesn't mean that, oh, if I work in a warehouse, GDT would be useful to me. If you are transporting a box of donations from your church to a needs area, that's a supply chain. You can use GDT to verify that you delivered that box of donations to the place that needed it. And it provides metrics. You can access your data and you can download it and use it to build a map of what quality assurance measures you are meeting in your organization. And it provides end-to-end communication. It's a software uniquely designed to function where needs are most critical. Low resource areas with limited access to internet and electricity. This includes conflict zones. A lot of times we ask organizations in conflict zones to fill out a lot of paperwork and use really complicated applications because we want to provide good donor oversight. We want to make sure that the stuff got to the place. But a lot of times we give them tools that are not suited for their environment or suited to their technical access or suited to their understanding of the questions being asked of them. So we made it free to use. And it doesn't require authentication, which a lot of people think is wrong, but I'm going to get into that. We have tamper-proof append-only records. The records cannot be edited. The data is fully encrypted. It's open source, and we do not require any downloads or any logins. So I've written some very simple architecture for how GDT works. And I'm going to share some links at the end of this presentation where you can look at our peer-reviewed publication and you can look at our instructional videos. But when you create a record in GDT, starting over here, you generate a unique key that is also attached to a QR code. And this green line represents the information that you store within that record. If you do not share this record key with anybody, you are the only person that will ever see the information that you enter in this record. The GOSQUIS team cannot see it. The dev team cannot see it. Only you have access to the information in that record key. But if you share that key with one or more people, they can see the information that you put in that record. Many people adding entries to a record creates a record history that can be seen and reviewed by anyone you allow to view it. Eventually, we're going to have a notification system that, despite the full encryption of this product, will allow people who view or make entries in the record to communicate with the person who made the record. And this is what's going to complete our end-to-end communication. This is the simplest form of global distributed tracking. This is the creation of one record. This is an example of a record group. Here, a parent key is generated. Once again, it has a unique key that is also connected to a QR code. And it can generate child keys. The parent key can see all of the entries or the activity that happens in the child key. This can happen through annotation. It can happen through tags. And we're constantly improving this feature. But the children cannot see what the parent does. The parent can see what the children do, and the children do not communicate with each other. Eventually, when we build the notification system, the parent will be able to receive notifications from whoever makes entries in the child keys. I know this sounds a little bit complicated, but just stay with me. Again, these are very, very simple concepts, and it's so simple sometimes it's hard to explain. But I'm going to give you some examples of how this works. This is our pilot program with decentralized medical device manufacturing based in Tucson, Arizona, a FDA registered manufacturing facility who are currently specializing in manufacturing open source tourniquets for need areas. And they are using global distributed tracking for their Class 1 FDA compliance. This includes tool maintenance schedules, quality acceptance records, labeling, device identification, complaints, recalls, and also distribution. So I'm going to be more careful here, and I'm going to go to their video. Now, I just showed you an example of a group record. This is a video of a group record in action with our partners at DMDM.
Humanitarian aid delivery is successful when shipments can be confidently sent and received. And with our free open source software, global distributed tracking, we make it possible to track these shipments around the world while fulfilling regulatory requirements that ensure safety and effectiveness. Through the eyes of the team at DMDM, Decentralized Medical Device Manufacturing, you'll see how GDT records are a part of their open source quality management system required for many international regulatory agencies. DMDM is an FDA-registered, nonprofit cooperative that manufactures tourniquets for low-resource settings and international conflict zones. And it's our GDT software that assists and complements their heroic work. The GDT group record allows them to track their tourniquet shipments at scale, where individual items, boxes, and crates can be tracked under one key. A group may contain any number of individual items. For example, DMDM will generate a group key for a box that contains 10 tourniquets and 10 child keys, one for each tourniquet in the box. This allows a notification and recall for individual items or batches. They print the child keys for each tourniquet and the group key on the box containing the tourniquets. Until the box is opened and the tourniquets are distributed, the group key lets DMDM track the shipment of the box. Shippers can add to the history of the box via the QR code without authenticating or revealing their identity. When the box is opened, individual users can submit feedback via the child keys. We make the tools for people who make a difference. Global distributed tracking. Trust through transparency.
So for manufacturing, if you're in manufacturing, you know that the FDA and EU regulatory bodies do require a recall mechanism. You have to be able to notify your user base of a recall and also collect user feedback. That is a little bit more stringent in the EU. But even though this is a requirement, there is really no guidelines or standards for how they should be implementing that. Do they need to set up an email tracking system? Do they need to have an intake form? A lot of times companies just have a website with maybe an email or a phone number, and that's how you're supposed to be able to fulfill these requirements. But at the end of the day, is that really a functional system that makes closed loop communication happen? Are you, as the manufacturer of a device, really connecting with your end user and being able to communicate from your end to them and receive feedback from them? So as we work on our notification system, we believe that it's going to set a new standard in regulatory compliance because it's going to allow distributors direct contact with the user. And allow a greater ability for data capture in a secure encrypted format. Now, I've talked a lot about manufacturing. We're going to go now to some aspects of the project that we've been working on. So we have a complete minimum viable product. You can check that out at gosquist.org. And we have the ability to create group records. You just saw the video for that. That allows you to securely organize objects or shipments and allows for recalls. We are architecting our notification system that alerts a record key owner when new entries have been made to a record. And this is for a record and also a group record. And we do have a planned API. We know that adoption of this system will depend on its ability to integrate with known systems. And we look forward to creating partnerships around that. So I've talked a lot about manufacturing and distributed data, and a lot of you may be thinking, well, I'm not a manufacturer and I don't know anything about open source design, and how can this help me? And I would encourage you to think of this not in a use case scenario, like, well, they use it in the manufacturing, they use it here, you know, how else do we use it? Think of it as a information flow, centralized documentation that is very easy to use. And the applications for this are quite diverse. So I want to show you some records that we have. This is a citizen science record that we created in 2024, where we put a GDT record QR code at Barton Springs, and we asked people to enter the number of turtles you see in front of this sign and write down the number of turtles. You can take a picture, or you can just write the number. And we got a lot of entries. All of these people were recording how many turtles that they saw. And this is a really good example of distributed data being centralized. One record was viewed by many people, and they voluntarily created what ends up being a record history. And this is an example of what a record looks like when you create it in GDT. We have end user reporting. So our partners at GLIA Poland shipped a box of tourniquets to Ukraine, and we received feedback from the TCC medic who did civilian tourniquet training. And we got pictures and we got feedback. This was very exciting. This is one of the first uses for manufacturing that we use GDT for with GLIA Poland. And it also can be used for tool and equipment maintenance. Here's an example of an oxygen concentrator being documented within GDT. So as we have built out this product and we continue to connect with the distributed impact community, I would say, whether it's in the open source world, whether it's in humanitarian aid, disaster relief, grassroots world, we understand that there are distributed groups, distributed data happening all the time. And how could GDT help these people do their work? How can we help people do more good work and reduce burnout, reduce confusion, improve communication, help people grow their team, improve quality assurance, and expand good work instead of shrinking it, which often happens after a disaster. So we want any person or organization that needs secure, fully encrypted, centralized data tracking to use GDT. So I'm sure a lot of you know how Hurricane Helene affected the Western North Carolina, Appalachia region. Actually, the anniversary of that is coming up next week. And for several days and weeks, search and rescue teams, not just from North Carolina, but from several states came in to help find missing people in the mountains. And there's been after action reports written about challenges that the SAR teams experienced in the field. And I'm going to read a section from one of these reports. So there was a lack of a unified missing persons tracking system, and this created critical delays in search prioritization. Search and rescue crews reported instances of duplicated efforts, with well checks conducted at the same home three to four times. Unnecessary or duplicative searches unnecessarily put rescue crews' safety at risk. And communication issues between search and rescue teams and law enforcement led to difficulties in obtaining and validating missing person information necessary for targeted searches. This happened despite the fact that teams used two very well-known software products on the ground, the Search and Rescue Common Operation Platform called SARCOP, and a state-level system, which is a mapping tool called SART-OPO. So I'm going to go back to our group record architecture here. Imagine that you're on a SAR team and you want to generate a group record. And I don't know how it would be quantified. Either we're going to make a group record for that day, a group record for that team, a group record for that grid zone, for that region, for that county. But a team could generate a group record and then generate child keys. Each of those child keys could become an identification that goes to a missing person or to an address. And all of that information that the SAR team collects in the field could be then stored in the individual child keys. Those child keys could then be shared with law enforcement or a state system, and it could be transparent to all of the people that need to know that information, not just everybody, but only the need to know people. Who searched that address? Where was that missing person found? Did I find a deceased person? How was that handled? Who did I coordinate with at the county level to receive that deceased person? Has the family been notified? There's so much information that could be streamlined with a GDT group record that I really think could help SAR. And I would love to sit down with people in the search and rescue community to see how we could deploy this with them, especially after we have a GDT API. I've talked a little bit about humanitarian aid and supply chain on an international level, but we have people in the United States who are with churches, with nonprofits, who are just good people with a car, who want to bring donations and supplies and humanitarian aid to places that have flooded, that have had hurricanes, that have had fires, people that are in your neighborhood, people that, maybe you're at a city and county level, but don't have a really big distribution network. And they may not have very good tech literacy. They may not be in a part of the country where there's even a really good quality internet. So could GDT be something that helps them verify aid delivery, aid location, and provide tracking along the way that you share with your team so everyone knows where everything is? There are already logistics softwares out there. There's inventory management software. We're not trying to be an inventory management system. However, the tracking IDs, the record key that GDT generates, could attach to your already known inventory system and provide a deeper level of quality assurance. And this is really important for nonprofits, because if you can prove that the stuff got to the place, then you are meeting a quality metric that is going to look really good to your donors. And as I showed with the basking turtles example, I believe that there's enormous application for scientific field research. If you have a team of 10 people on the side of a mountain collecting moss or collecting, scientific samples, you could create one record key for that project, and everyone can input the temperature, the pictures, the things that they're seeing on the ground in a centralized way. And for those of us who are using Google Sheets, who are using Discord, or even just a notepad, one can say, well, we already have a place we write stuff down in. Well, everything that you put in GDT can be transported as a CSV. It can talk to your known documentation systems. We feel that if you have one place for your team to collect simple data, and they can see it at the same time that it's being collected, and you don't have to log in, it's going to increase documentation. Because coming from the medical world, if you don't write it down, it did not exist. We want to encourage people to create documentation and share it with their team, because that's going to create trust. And when you create trust, you have more people working together. And when you have that happening, more good things are happening in the world. So the global open source quality assurance system does have some far-reaching goals. We believe there is potentially the capability that this organization could be an international regulatory body, at least in providing some sort of framework that, of course, would be open source. How could we help countries that don't have a trustworthy or any regulatory system create a framework so that they can have high quality in-country manufacturing, high quality in-country quality assurance for food and for public works and for anything, basically. We see the organization as an umbrella for other open source quality assurance tools that the community develops. If you have a project you're working on, if there's something you're already using for quality assurance, that is fantastic. Do you want to link it to GOSQUIS? Is it something that we can help the community know more about? And of course, we're going to continue to develop global distributed tracking while supporting current features. We have some research that we've started on some potential revenue generating offers that would, of course, support the free access to global distributed tracking. And this research is surrounding unique device identifiers, or UDI, as required by the FDA, and serial number management. Serial number management is an offer that I believe manufacturers who are not open source connected at all would really want to adopt, because it would help combat the massive amounts of fraud and imposters that small manufacturers encounter constantly, especially if you're an e-commerce company. So there are some links here. I won't go into all of them, but these are our technical papers hosted on the OSMS website. We have an IEEE publication that we're going to be presenting at the Global Health Technology Conference in Golden, Colorado in October. And we have links to our instructional videos and to our user guide. And you will be receiving this public slideshow in your follow-up email from Public Invention. So I'm going to stop sharing so that I can see you all again. And we are ready for questions. All right. Who has questions? Mons, go ahead.
First of all, thank you so much. I'm a long waiter for this global tracking system, the distributed tracking system. I should say that I was not very much familiar with how it works. I'm a researcher, by the way, so if for the rest, so I'm not really familiar with with the distribution, with the quality assurance, but slowly learning that because I have open source work and I want those to reach to more people. My question is like for the for FDA, for CE, for other regulatory bodies, they have sets of compliances. But if you want to put this as a part of developing world, and they don't have a set of compliances, uh, is Goskas gonna have a kind of cover a common set of compliances like data privacy, then what else? Like other compliances that I like quality assurance compliances for the medical devices, those things.
I think it is way too early to even ask those questions because we've like the idea of GOSWIS being a regulatory body, like that idea is just a few months old. We haven't even written a paper on it. I would say in terms of manufacturing, we would probably be heavily inspired by regulatory bodies that already exist and would take inspiration from the ground because a lot of times what happens is you have people in the West thinking that a low resource area functions a certain way when it actually doesn't. So what a low resource area needs to succeed in manufacturing is compliance requirements that make you meet a high standard, but also understand the environment that you're in. They meet you where you are. So um, it, I think that's one of the biggest things we could probably help with. You need to listen to the people on the ground. And, maybe we don't need to build a $60 million facility to make very good compliant wheelchairs. Maybe we need to build just a $1 million facility that has, certain standards, and you can make very good wheelchairs for less money, but that are still high quality. It's all in, I think, being informed by the environment and the community, because you, I think a lot of times people want standards, but people don't know how to create that. There's like not everyone has that gift. And how can you look at something that's made very well and translate that into documentation so that other people can replicate that pattern? So I think this is something we should explore. And they're actually this is an idea that's 48 hours old. There's a meeting we're going to have with the community in November around this topic, and I'll talk about that in a little bit. I'll put some information in the chat. So too soon to tell on what we would be making or requiring for GOSQUIS there, Mons, but we're very open to developing it because we would only want to create standards that are helpful, not denigrating, but helpful and elevating and supportive. That's why we're here. Simple to understand. Okay, I think Joe is next. Joe?
Sorry, coming off mute. Yeah, so I'm involved with a lot of open source software projects. And one thing that I see a lot in the open source software community is a lot of collaboration with industry. So there's sort of like a dual license model where you say, this is free to use for non-commercial purposes. This is, potentially even free infrastructure like you're doing. And the way that's possible is it's supported by the commercial licensed software or the commercial licensed infrastructure. And so I think it would be great if you had a commercial license or commercial option where you could say, hey, if you are a commercial entity and you find value in the same system, then instead of having a separate instance, I mean, the fact that you already have sort of this independent keys that are, it's all global and but still isolated to the creator, that you could say, if you're a commercial entity and you donate, X thousands of dollars, or you'd pay that for the license or however you want to frame it, then you can create, 100,000 keys for that amount of money or whatever. And that will help pay for running the infrastructure and improving the software and making forward progress. But then the company also gets all the benefits, for, the same type of things that you would you want to do. Anyway, just a suggestion, or I don't know if it's already something in your plans or what, but I just wanted to bring it up.
That's a new idea, and Rob is literally writing that down right now. Okay, Rob, go ahead.
Um, well, in the interest of being fun, I'll say I'm strongly, strongly opposed to that idea. Um, because I want the system to be free as long as it can be. And the truth is, when it comes to supporting a number of keys or even a certain usage against that keys, for a tiny amount of money, like $1,000, we can support an enormous number of keys and an enormous number of activity against the keys.
So does that mean that the system is currently open to commercial use?
Sure. Yeah, it's intended to be. Yeah, you can make money from it. We're not discriminating in that sense. It's open source, but anyone can use it.
Okay,
Anyone,
Yeah.
so it's not
Yeah.
limited to non-commercial use like many
No,
software
no.
packages are. So okay,
No,
that's good.
Yeah,
Yeah.
it's open source software, and it scratches an itch that open source medical devices and other open source things need. But that doesn't mean it's you have to be producing an open source product in order to use it. Okay,
Okay,
like
that's a
literally
good
IBM,
clarification.
Johnson and Johnson, or Tesla, or somebody could use it right now. So I wanted to address Dr. Alam's statement. So when he was talking about compliances, that word, there's a lot of different meanings to that word. Okay, but one thing that is really strong about GDT, um, is its ability to address a fraction of what the US FDA requires of everyone who's making a medical device. Okay. And I've read these regulations quite a bit, so I understand them. And it gives me a chance to explain how Victoria says we're going to improve on existing systems. Okay. Now, if you think about a particular device, there may be many ways in which you want to assure the quality of it. Okay. But even the FDA doesn't really tell you what those are. It's your job to document those and develop what they are. But what they do demand is that you have a complaint tracking system. In the case of drugs, we call that an adverse event tracking system. You take a pill, my tummy hurts, I have to track that. Okay. In the case of medical devices, it's the same thing. The FDA requires every firm to do this. Okay. However, they provide very little specification as to how that is to be done. We believe that with GDT, you would collect more data from more users because we don't require a login. You don't have to give out any information, and you don't have to go through the process of authenticating and creating something. So, for example, with GDT, you can use your phone. You can, for example, not speak English, right? And you can point your phone at something, take a picture of it, and then you can just enter a tag that says bad or damaged or received or inspected, or you can say something like it was broken when I got it. Okay. Now, if someone receives an anonymous report, they should take it with a grain of salt. Maybe it's not a real person, but that's better than no information whatsoever, right? And so, for example, if a nonprofit distributes 10,000 devices across, let's say, a country I'm a little familiar with, Tanzania, um, and only 1% of the people click on it, then you're getting a lot of information from 1% of those that people have actually received and used those medical devices. Okay. and it prevents fraud, because if some fraction of those 100, 1% of 10,000 would be 100. If 50% of those 100 come from China, then you reasonably believe this shipment was stolen and it was sent to China and resold there. So let me just answer another thing that Joe said. So I believe certain services you have to charge for, and serial number management is one of them. Okay. We are not currently doing serial number management, right? Okay. And today there are many firms which charge you for serial number management, and you can use them, and they often, produce barcodes for you, and there are other services that they provide. The US FDA requires unique device identification, which can be solved by using serial numbers. That would be the most obvious way to solve that problem. There might be other ways to do it, right? That the US FDA doesn't say you have to use one of these firms, but there are other ways of doing it. If Gasquas adds to its product line and offers serial number management, I think we will have to charge for it. Okay. But the truth is, just from a computer science point of view, GDT has extremely low marginal cost for the production of a new record. There's
So I
no
guess what's the difference?
connectivity.
Why is serial number management so much more expensive to operate than unlimited number of keys?
Because it requires human intervention. If you do serial number management, you have to have a human being who partially manages the allotment of those serial numbers to a given organization and records it, and it can't be completely anonymous.
Okay, so you have to have a login that ties the generation of that key to or serial number to your organization. But isn't that
or
already
some
what you have?
or some
Already
other
are whoever created it created it.
Yes, but when you create a serial number, whoever created it wants to register with, for example, the US FDA, that I'm IBM and I own these 1 million serial numbers. They're our serial numbers and not somebody else's. With GDT, anyone anonymously, without telling who they are, even to create things, you don't have to log in. You can go create a GDT key right now, and we don't have to authenticate you. We don't have to prove anything about you. So in that sense, it's easier than serial number
Sure.
management.
So do you currently have the option, or is it always anonymous no matter what?
It's always anonymous, except a user may choose to reveal their identity in the record
Okay, in just like as a comment, not there's
as a
no
as
there's
a
no
comment.
accounts or anything like that.
Yeah, as a comment.
Right. And when would someone want to do that? Well, let's say you're a big medical firm. I'll say Johnson and Johnson. Okay. You have inventory management within a frontier, but eventually things leave your control and you no longer have inventory management at that point. But you may have distributors who are in your trust network, right? Who you have influence on those distributors because they make money reselling your equipment. And so they have a vested interest in your success and you have a vested interest in their success. So what you do is you take your normal Johnson and Johnson inventory item, you put a GDT sticker on it, and then you tell your distributors, please create a chain of custody as you receive and ship this item. Okay. And then they're adding to this the GDT data, which can be tied to your inventory number. Now, GDT doesn't force them to do that. But if they all believe, well, we'll make more money by preventing fraud by proving that these are genuine Johnson and Johnson items, and therefore people will buy them from us, then they at least have an incentive to do as Johnson and Johnson asked. And they might say, I'm a distributor in Egypt. I did indeed receive a carton of 1,000 tourniquets this is my name, and I shipped it to Nigeria. Go ahead, Victoria. Sorry.
So we could definitely get into the weeds on a lot of technical aspects, but I did want to give some room for a little bit of brainstorming because we have Daniel Fontaine here, who is a connection of mine from the humanitarian disaster response sector, and he is connected to SAR, and he does SAR teams himself, and he helped out in Hurricane Helene and the Texas Hill Country SAR expeditions. So Daniel, what do you think so far on the idea that GDT could maybe help with this really horrible SAR data and communications issue?
I think it has potential for sure. I'd love to speak with you and the team, I guess, and figure out like exactly how it can fit in to SAR operations and aid operations, like exactly like iron out the details and have a better understanding about how it plays a part in that.
Yeah.
But what I've seen this evening in the conversations and discussions, I think it has great potential.
The nice thing about this is it's completely open source code, so you can run it locally. Like the SAR teams don't need to go to goscos.org to use GDT. I mean, it would be nice if they did. I mean, you're welcome to do so, but you can take the GDT code and run it locally and have it be like, you know, Texas SAR team GDT and, you know, Yancey County SAR team GDT. We want the system to be used. You know, it's there to increase documentation, increase communication and collaboration, and we think that's one of the big advantages that sometimes maybe I don't communicate well enough is you can run this locally. So maybe there's a potential, because I know Daniel SAR does training and, you know, drills and all sorts of things. Maybe it's something you could trial in that manner.
Yeah, absolutely. Like I said, I think I need to have some, I guess, a side conversation and work out the details. But
Yeah.
with what I have going on right now, I'm actually going to be getting a lot more into that. So the potential to set that up and run a training and stuff like that is rapidly approaching in my environment, what I'm doing.
Awesome. So in the slide deck, if you go to slide 12 and go to the link below the photo there, that is the explanation of our group record. And that was my example that I used for a potential SAR application. I mean, you could use a single record, that'd be fine. But I think a group record would probably pertain more to a team. So if you watch that video and you see how DMDM manages the box and the individual items in the box with a group record, and you translate that to your SAR workflow, I think that would be a good starting point. And of course, I'm more than happy to meet with your team and we can brainstorm it out.
You know, I think that requires a meeting because to tell you the truth, I'm not sure how that would work myself.
Well, I guess to me it's really clear, but we can set something up, Daniel. We'll talk offline.
Good.
Yeah. All right. Any questions from anybody else?
I have an additional question. Sorry for asking.
No worries. No worries.
Just I'm trying to understand the system. I think this could be very good for my research in terms of like open source devices that I'm developing in developing countries. Say to know that my question is how can I download the reports
Yes.
by all the so in a centralized way?
It's in CSV format.
Okay. And how long the report stays in the GDT? All the records,
They don't have an expiration date.
like 5 years? Oh, no expiration?
We currently have no expiration date. And if we ever added a
Okay.
feature like that, the community would be aware of it.
Okay, great. Yeah.
Yeah.
And just to create a group record and downloading the barcode and sticking the barcode to the device, and then the clients, or in this case the participants, I can ask them to scan and give us the update instead of going and collecting the data.
Right. So for instance, let's say you
Yeah.
have a wheelchair that you've deployed, in another country, and you have, 10 users of different use of diverse habitus and, diverse environment who
Mm.
are going to try out this wheelchair, paved road and grass and, rocks and
Mhm.
up a mountain and down a mountain. You can share that wheelchair code or have it on the wheelchair itself, and each user can document their experience with the wheelchair. Like, it was raining today and this was what happened, and or it got stuck on a rock and this is what happened. Because imagine if you were trying to chase that feedback
Yeah,
through
yeah.
through through 10 individual emails and trying to match up, well, were they doing this at night or the afternoon? Was it sunny? Like, there's a lot of variables, but having that timestamp on that data saves you so much like brain work.
Now the current system is actually from top to bottom is like researchers actually set a schedule to collect the data every week, every month. But this system, if we could implement, and this could be like bi-directional, or at
Exactly.
least from the client side, they can always send the data, and later on we can actually use whichever we want to use. We can, in the ethics, we can mention that, we're gonna ask for them to report every week through the
Yes.
system.
Yes,
Mhm.
exactly. Like, you can give it exactly an instruction to your sample and say, please make an entry like every Tuesday evening on,
Mm.
on these data points. And if they know that they're expected to do that, it's very easy to make the input, and it's centralized. You always know where
Do
that
they need
data
a
is.
smartphone? Do they need a smartphone to make an entry, to have the camera, to
it,
have
it
the...
it has you have to have a camera. However, there is the record URL. If they don't have a camera phone, they could access it through browser.
Well, these days in the developing world, camera phone is more accessible than a computer.
Exactly. Yeah, yeah,
Thank you.
yeah.
Just
We'd
one
love
last
to.
question. Yeah,
Yeah.
because this is de-identify data. So, but from the parent side, from the control side, can I see who is entering the data?
Because it's completely encrypted and we don't require login, the only way you would know who is entering the data is if the person identified themselves or you asked them to. So,
Or at least the device wise, is the device, we know the device number one is giving the report versus device number
yes,
10. Yeah.
yes, 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 yes. All right, we are getting close to the end of the meeting. Are there any questions from anyone else? Okay, so I'm going to put into the chat here a very, very new idea that I'm sure everyone here will be getting some notifications on. But in November, there is going to be a large community webinar around distributed tools for quality assurance. We are looking for people who have actual products that they're using. These are probably going to be largely digital products and, open source ones perhaps as well. And then people who have ideas and theories on how we should do quality assurance. And we have tentatively made a schedule. So November 19th at 8 p.m. Central, and November 22nd in the morning, probably 9 a.m.-ish. So this is going to be hosted by Public Invention, Gosquas, and Internet of Production Alliance. And the discussion is completely centered around distributed tools for quality assurance. We're scoping the community of people who are discussing and using distributed quality assurance tools. And we want to learn more about that ecosystem so that we can apply for an NSF Phase 1 POSE grant that would help us do a larger scoping of distributed tools for quality assurance. So if you're here at the meeting, you'll be getting a email about this and all the information. It's going to be really exciting having these conversations because, as I mentioned earlier, Gosquas wants to be an umbrella of support for people who are working on quality assurance or trying to scale a tool they've been working on. Like, how can we help you scale something? Maybe we don't need to make something from scratch. Maybe something is already working really well. Well, let's learn about it, you know, save everybody some time. So we're really looking forward to having that meeting with the community.
Okay. If no one else has thought of a question, sometimes after I turn off the recording, people think of questions. I'd like to thank Victoria for this. It's a very exciting project. As Victoria said, I really do believe it's so simple that it's hard to understand. And so y'all can email me if you're watching this on YouTube after the recording. You'll be able to find my email address. It's just my last name dot my first name, read.robert@gmail.com, and I'll be happy to give you a technical description, probably more technical than you want. And I'd like to take a step back and just point out that what Victoria said at the beginning is really true. The open source movement can become a power in the world, but people need to trust it. And if, let's say, a dozen very small firms are making something, they don't necessarily have a built up reputation the way a large medical device firm has a reputation. And not having a reputation, it's extremely important that they rely on testing, quality assurance, and documentation of that effect in order to build trust through transparency. So instead of trust through reputation, we're trying to build trust through actual data about what it is that you're getting, or trust through transparency. So if let me also remind everyone, Public Invention is US 501c3. We really need your donations because it helps prove to the IRS that we should be a US public charity. And this Inventors Gathering occurs the third Thursday of every month, and we hope to see you at some in the future. Victoria, do you have any final words?
Well, thank you everyone for your time and attention. And for all of us in the open source world, I just remember that we're very early. We're very, very early in creating tools that can be scaled on a really, really broad adoption that can really make some impact in the world. So the more we have people using good tools that are easy to use, that help us create trust, the more we put good information into the world.